Good morning and good afternoon to our distinguished speakers and to all of you who have joined us here today for this event. I'm Flori Lazier, President and CEO of Corporate Council on Africa, the leading U.S. business association focused solely on connecting business interests in Africa. I want to personally thank you all for taking the time to join us today for the one-year anniversary of CCA's U.S.-Africa Health Security and Resilience Initiative, or as we fondly call it, HSRI. HSRI was launched in December of 2020 to provide a platform that fosters linkages, information exchange, and collaboration to drive investments that are crucial to Africa's health systems. In its first year, HSRI task force members have brought together key U.S. and African business executives, senior government officials from both the U.S. and Africa, and leaders of multinational and multilateral organizations to highlight core issues ranging from leveraging private sector skills to addressing current health sector supply chain bottlenecks and capacity building needs, as well as regulatory frameworks that are needed and will provide the enabling environments for increased trade, investment, and expanded use of digital health solutions. With that, we would now love to show you a video highlighting HSRI's work over the last year.
No sound, Flori.
Yeah. I'm thinking the team is working on this. Carla, you'll start the video again, please, with sound. CCA's U.S.-Africa Health Security and Resilience Initiative will serve as a platform that fosters linkages, information exchange, and collaboration to drive investment and trade crucial to the development of Africa's health system.
A series developed by CCA's Health Security and Resilience Initiative, which is an initiative that has three pillars devoted to disease management and service delivery, to universal health coverage, and to trade and investment opportunities for health in Africa. Through this initiative, CCA is exploring how the private sector can help African governments and societies to advance their healthcare systems, particularly the public health supply chain, to better meet patient needs and improve the availability of medicines, diagnostics, and vaccines to those who need them.
For me, I'm quite excited actually about this launch
I think we can all agree that COVID-19 has brought into sharp focus the need for continuous and deepened collaboration and investments in public health, right? So we can also agree that the private sector has an important role to play, together with governments, NGOs, healthcare professionals, and other stakeholders to strengthen public health initiatives worldwide.
As long as we have significant populations not vaccinated, we don't know how this mutation will take place and where it will go. From an economic standpoint, it's imperative because we cannot have a sustained economic recovery in the world without tackling this inequity of access.
Pfizer and BioNTech recently announced the signing of a letter of intent with the BioVac Institute, a Cape Town-based South African biopharmaceutical company, to manufacture the Pfizer BioNTech COVID-19 vaccine for distribution within the Africa Union.
Getting the fourth industrial revolution and digital transformation right is an existential issue for us in Africa. It's not a nice to have, but when we're comparing ourselves to countries that have healthcare, that actually have access, we don't have access.
We need to make the most of every encounter we have with an individual who's willing to undergo testing, and not just test them for COVID here, HIV there, and hepatitis in a third spot, and get a lot smarter about how we address this collection of pandemics we're fighting in a more organized and efficient manner.
In my 30 years career in public health, I've never seen the continent of Africa exercise the kind of leadership that they have exercised during this period. From the time the President Cyril Ramaphosa was the chair of the African Union, he actually exercised what I call visionary and practical leadership by rallying the continent around, by engaging the private sector and engaging all actors across the board.
So I'd like to give special recognition to the initiative's seed funder, Pfizer. Your support shows how committed you are to CCA and to strengthening and advancing Africa's health systems, as well as commercial ties between the US and Africa. I would also like to acknowledge and thank Gilead Sciences for their sponsorship of the initiative. Let me also thank the HSRI task force members for their contributions to the success of the initiative thus far, with a special thank you to Dr. Jeffrey Sturchio, Chairman of Raven Martin, and also Chairman of the CCA Board, as well as Angela Wasuna, Vice President, Global Policy Emerging Markets at Pfizer, who together are the co-chairs of the initiative's task force. The theme of today's program is strengthening health security and resilience in Africa, the continuing critical role of the private sector. And we are delighted to feature a group of private sector experts directly involved in strengthening Africa's health systems for improved service delivery in the region. Today's discussions will highlight private sector solutions and best practices that support transformation in disease preparedness, universal health coverage, and trade and investment in Africa's health systems. With that, I am delighted to introduce Patrick Vanderloo, Regional President for Africa and the Middle East, Pfizer. Patrick was appointed in December 2020 to lead commercial operations for Africa and the Middle East and develop breakthroughs across all key therapy areas, including vaccines, oncology, rare diseases, internal medicine, hospitals, and inflammation and immunology. Patrick Pfizer experience spans more than 20 years in leadership roles across Europe, Canada, Asia Pacific, and in New York within multiple departments. He has managed some of the largest therapeutic areas in cardiovascular and neuroscience globally and led the commercial development efforts of a 500+ molecule business. Patrick also led Pfizer's Essential Health Division for Asia, and along with 3,100 colleagues, strive to improve global health by making Pfizer medicines increasingly accessible to patients, something that we know they are also doing in Africa now. So without further ado, I'd like to turn it over to Patrick.
Thank you very much, Flory. Good afternoon, and a big thank you to all of those who have joined us today. I would like to thank the CCA for convening this session and appreciate the opportunity to make a few opening comments with such esteemed guests. It's an honor to be with you all today. As we have all seen and experienced, and as you heard from my colleague Angela Wasuna in the video, COVID-19 has brought into sharp focus the need for deepened collaboration and investment in public health and support for equitable access to innovations. At Pfizer, we do believe that equitable access to vaccines is a collective responsibility that calls for a highly coordinated and collaborative action by public and private stakeholders alike to end the pandemic. It is in that spirit that we remain committed to partnering with countries and organizations like the AU and COVAX to reduce the impact of this devastating disease on the African continent. We have pledged to provide 2 billion doses of our COVID-19 vaccine to low and middle income countries in 2021 and 2022, at least 1 billion doses each year. Our current allocation to low to middle income countries from all of our supply pathways, so both bilateral as well as through COVAX and collaborations with the USG, has already surpassed this pledge in 2021 with over 1.1 billion doses contracted for these countries. Thanks to those close collaborations with governments across the continent and with organizations like COVAX, as well as donations from the USG and the European Union, we have delivered doses of our vaccine to 29 African countries to date. Building also on our Prevnar 13 experience for the formulation, packaging, and release of that vaccine, Pfizer announced in July of this year the signing of a letter of intent with the BioVac Institute, a South African biopharmaceutical company, to manufacture the Pfizer-BioNTech COVID-19 vaccine for distribution within the African Union member states. Now, one of the key issues isn't as much the availability of doses alone, but also the readiness to receive and distribute them on the continent, an area that we acknowledge we need to do and can do better. We are supporting a number of programs in partnership with governments and NGOs to help strengthen supply chain capabilities, such as our recently announced partnership with Zipline to develop deep cold chain capabilities to drone deliver vaccines to more remote locations in Africa. We also recently announced, in partnership with the Medicines Patent Pool, the signing of a voluntary license agreement for Pfizer's COVID-19 oral antiviral treatment candidate, Paxlovid, which is administered in combination with low-dose ritonavir. This agreement will enable MPP to facilitate additional production and distribution of our antiviral, pending regulatory authorization or approval, by granting sub-licenses to qualified generic medicine manufacturers, with the goal of facilitating greater access to low and middle income countries across the global population. Obviously, successful patronship between the public and private sector is key in not only overcoming this pandemic we're all facing, but supporting patient access to different innovative therapeutic medicines and achieving better health outcomes. Much more can be done, and there is so much room for other players who are interested in mutually beneficial, well-defined partnership that serve to further develop African healthcare systems and serve African patients. Thank you again for letting me say a few words. Let me now turn it over back to Flory, who will take us through the rest of today's session. Flory, over to you.
Thank you so much, Patrick, for your thoughtful remarks. Now, I am so pleased to turn to Mr. Ikechukwu Ofuani, Ike, as we call him, Director of Worldwide Government Affairs and Policy, West Africa with Johnson & Johnson, who will moderate today's panel discussion on the continuing critical role of the private sector. Before I turn it over to Ike, though, I just want to go over quickly some of the housekeeping rules for our question and answer period. Please do make sure to use the Zoom chat function to send us your questions. Please include your name and affiliation when you submit your questions. And we certainly hope that we will get to as many of them as we possibly can. We know that we'll have a really interesting and exciting discussion and look forward to that as well as your questions. So without further ado, let me welcome Ike.
Thank you so much, Flory. And thank you for the great work you and the team are doing over there at the CCA. It is indeed an honor for me to be facilitating this session today with all of my distinguished panelists that will be joining me as well. Without further ado, I would ask my panelists to come on and I would introduce them. And of course, as Flory has said, please use the chat box if you do have questions for the panelists as we proceed along the line. With me on the panel today are the following. I'm missing one of them, but I'll go along with the three that I do have here. Dr. Anton Biesel, he's the CEO of the Biesel Group. We also have Sally Ethelson. She's the Director of Resource Mobilization and Outreach, Malaria Vaccines at PATH. I also have with us Christopher Whitfield. He's the General Manager, Africa Region, Global Patient Solutions at Gilead Sciences. I'll just give a brief background and then we'll move on to the questions for my panelists. As we reflect on the first year of the HSRI, the Health Security and Resilience Initiative, we're drawing lessons on how best to build resilient health systems on the continent and inform our work moving forward. Our members provide an array of best practices ranging from how best to engage with governments to how best to integrate disease management in service delivery, and of course with a primary healthcare approach to putting in place private-public partnerships that seek to build resilient health systems in Africa. I'll go over to my first panelist, Dr. Anton Biesel of the Biesel Group. Addressing Ebola in DRC, can you share some experiences or some examples on engaging governments and driving results in under-resourced settings?
Good morning, and thanks to, first of all, Flory and the Corporate Council in Africa for the invitation to serve on this panel, as well as to provide our perspective on strengthening health security and resilience in Africa, continuing the critical role of private sector at the U.S. Africa Health Securities and Resilience Initiative. Dr. Ofuani, ask you a question. The Biesel Group, we've been successful as a small business enterprise in supporting governments in achieving success for the health, in the areas of health capacity building for several years. There are several ways in which private sector can better address the demand for various capabilities on a continent through partnering with governments and local stakeholders. There are three areas that I would like to address, and that's really engaging governments and driving results in under-resourced settings, also emergency response and capacity building, as well as establishing private-public partnerships in building resilient health amongst communities, especially through food security and some other areas. But before I address the question, let me really provide you with some background on the Biesel Group, or we affectionately call Biesel. We are a global management consulting firm, and we specialize in public health strengthening, workforce innovation, and economic development. Our global programs focus on the provision of effective, efficient, and timely and fiscally responsible global health, youth empowerment, and economic development solutions that improve the overall quality of life for people in low, emerging, and middle-income countries. We use participatory approaches. Our diverse experts, they leverage the combined experience and methodologies used in our work with various federal agencies. We look at mainstreaming gender in all our activities. We also recognize and build on inherent knowledge, as well as monitoring, evaluation, data, and expertise in communities that we serve. The vision and foundation of our company is a commitment to building healthy, secure, connected, and sustainable communities across our nation and around our globe. I'm very proud of our team's work. We really started in the areas of global health security through communications, partnerships, and program implementation, as well as analytic support, where we're supporting the Centers for Disease Control and Prevention, their office, or the Centers for Global Health, through their global health security agenda, and whereby we are advancing public health interventions, policies, programs, systems, and currently emerging and future public health threats. So when we're addressing those three areas that we want to look at with this question, through engaging governments and driving results in under-resourced settings, we're doing work in the Democratic Republic of the Congo, where we're addressing Ebola and trying to eradicate that. Through our work with CDC, we're on the front lines of combating the current Ebola viral disease outbreak in DRC, which we are part of a larger global outbreak and response network team of medical professionals, epidemiologists, and information technologies from CDC, the World Health Organization, as well as the Ministry of Health in DRC. And together we're working to coordinate across various agencies to best leverage technical guidance on surveillance, contact tracing, as well as management of associated data through mentoring and training of staff on associated Ebola surveillance, contact tracing, and data management, as well as evaluation activities. We're also working through the providing guidance on infection prevention control, as well as Ebola suspect case isolation assessments. And we also perform evaluations in the North Kivu area, as well as other associated activities around the security provision within DRC. So our work really focuses on strengthening the early detection and health response systems for outbreaks and epidemics. And we build on health systems, mainly the primary healthcare units in the communities and linkages within secondary and tertiary facilities. And overall, we're trying to build and strengthen the health system in DRC. At any given time, there are really 5 to 6 epidemics going on every year. And as we speak today, our staff are on the front lines with CDC as well as DRC to respond to 5 ongoing epidemics. And that's really around Ebola, COVID-19, cholera, polio, meningitis, and monkeypox. We have 10 staff members that are providing technical assistance to the government of the Democratic Republic of the Congo. In fact, I just returned last week from there working with the staff. We also have work in Uganda where we're providing global health, public health technical expertise, where we're trying to build the capacity of the National Public Health Institutes in their response to COVID-19 and other disease outbreaks. Particularly, we're working with CDC as well as the National Public Health Institutes to address COVID-19 and future disease threats by increasing country as well as regional capacity to record reliable, timely information on cause-specific mortality. So those are just some of the areas addressing that. When we're looking at the emergency response and capacity building, we're doing some work in DRC again through the emergency response and capacity building through several programmatic areas. And those are health workforce development, laboratory strengthening, surveillance, and promotional of COVID-19 vaccinations, as well as emergency response. And we also are doing some philanthropy work. But let me just highlight just a few of those areas. We're really in the field and we're working with, collaborating with folks on field epidemiology and training program, or FETP as is known. That's through a collaboration with the University of Kinshasa and AFINET. Our doctors are training others on how to really detect disease and also deploy to the front lines for early detection, response through treatments, vaccinations, and community education. We're also focused on training lab scientists, technicians, and providing equipment and labs across the country just to accelerate early testing and detection of Ebola, COVID, HIV, and other diseases. Our goal is really to strengthen the surveillance systems within several countries. Also, we're out there promoting vaccinations. Just returning from DRC, they have less than 1% of their population which is vaccinated. Their first batch of vaccines expired and had to be dumped and quickly shipped to Ivory Coast just for use there. Our staff has been recording and working with the areas of risk communication and community engagement, immunizations, vaccine promotion, and all with the intention of really increasing the uptake of COVID vaccines and routine immunizations that really have fallen behind during the pandemic. And so we're also working with border health authorities to enforce travel bans, enforcing testing, and those are just a few other areas. But also we're working with, even in the community, we feel that if we're there working, we should also provide some philanthropy. We just went to an orphanage in Goma, which is in Eastern Congo, where we contributed water tanks, beds, mattresses, mosquito nets as well, because we feel like there should be something that we should be doing as well. And also through public-private partnerships, we're working with communities, especially Goma and the Equatorial Province, to come up with innovative models that will include boreholes, water purification units, kiosks, and other modern, more innovative technologies as well for waterborne illnesses. And finally, through a public-private partnership, we're building resilient, healthy communities, especially in areas of food security, we're working with Tanzania now as a result of just our work through the U.S. and also CCA opportunity that we had during the UN General Assembly, where we were a part of the group when we were visited by the president of the Republic of Tanzania. So we're in the early stages now of setting up and developing a food processing plant in Tanzania. And this endeavor will focus on training, working with local women and youth farmers, entrepreneurs in the processing, packaging, and finding both export and local markets for their products. This will go a long ways in setting up sustainable food industry and working with Tanzania which lacks and also added value chain. And we're also looking at which sources for higher prices for the food commodities, and in return, higher income earnings for the local women and farmers. So in all, this is really how we're doing it with the Brazil Group in engaging governments and driving results in those under-resourced settings, also building capacity within communities, and also through public-private partnerships and building resilient health amongst communities. And I like to say that all of this work really began here in Brazil through our work, especially in the Africa region, through our work with CCA, through the Office of the Small Business, Office of International Trade at SBA, and the Department of Commerce through the Office on Africa, as well as our original work with USAID 10 years ago and the African Union. So, and I'll just say, for those small business enterprises that are looking for how do you enter the health security area or other types of partnerships and entrepreneurships with Africa, I suggest that you become a part of the CCA because it's been a valuable experience for us here at Brazil. So that answers our question in hopefully a short period of time.
Thank you so much, Dr. Anton. The CCA continues to be that platform to provide the right kind of access, to provide the right kind of systems for the right conversations to take place. What I pick from what all you have said, three key things I'll summarize from this. Having the right kind of surveillance systems in place on the continent is very critical to ensure that we are adequately prepared to fight pandemics. Map disease progression, get the right systems in place, quite very, very critical. And also collaboration with partners in deploying these solutions on the continent is extremely important and critical. Partners like the NCDC, National Public Health Institutions, all of these partners that you have deployed these solutions with on the continent in Uganda and DRC and all the places you've mentioned is also extremely important. One last thing I picked also is regarding PPPs. Understanding the right kind of focus that governments on the continent bring, the right kind of value they bring to whatever issues it is, but for you, food security is quite important to ensuring that you can put the right infrastructures in place and of course, channel the right resources towards addressing all of these critical issues. Great work that you're doing over there on the continent. I will come back to you, but let me move over to Dr. Christopher. Also, fantastic work, Dr. Christopher and your team you are doing. The investments in HIV and strengthening health systems on the continent are already yielding fruits, great fruits, contributing to the needed global response in addressing current and future pandemics. Today, South Africa's investment in genomic sequencing, also talking about disease surveillance and pandemic preparedness, has given visibility to the threat of emerging COVID-19 variants. Now, investing in primary healthcare delivery, are there lessons that you can share with us from HIV and hepatitis?
Okay, thank you very much. Excuse me, it's great to be here with the CCA family and also the HSRI group. It's just a little bit on myself and what Gilead is doing. We really appreciate this relationship and opportunity to talk to you and your audience. As you guys know, Gilead's been around for 30 plus years and it's grown into a medium-sized, huge company. And I'd like to say that the GPS group that I participate in, that I work in, is more or less Gilead's special forces. We go into over 100 countries, trying to understand more plainly what are some of the practical issues in terms of a patient's pathway to care. And practically speaking, in Africa, we have 54 different health policy areas, 54 different countries that really try to address primary health care and treatment on a variety of different spectrums. So essentially, Gilead works in the public health with public health officials, community advocates, researchers, and healthcare providers to bring scientific breakthroughs to the patients in Africa. A couple of things that we like to focus on is really around Gilead's developed some of the first therapies for COVID-19. And we've had the ability to have over 2 million patients really experience those through our partners, through our voluntary license program. We've also had a long history in dealing with and transforming the HIV prevention and care area. HIV is kind of our strong suit. We've got a variety of different initiatives, but one of the things that we quickly figure out is that the commitment goes far beyond just providing the medication. We invest heavily straight across the region in programs to help improve the health access at different levels within the healthcare system, principally in primary care, to help eliminate barriers that really prevent patients from really experiencing the product and getting the full impact of the products across the range. And the other piece of that is that you cannot do this alone. Gilead has built a network, and we're experts at it, I think, of building a network of like-minded stakeholders across the range to help the patients through that pathway. So from the screening of a patient that has hepatitis or HIV, through understanding the diagnostics that are necessary, we have partners there, through understanding how do we actually refer those patients to care and what kind of infrastructures can we help and support put in place, whether it be at the primary healthcare setting or otherwise, to make sure that this happens for those patients. And then ultimately treatment and then follow-up, because loss to care is a significant issue for patients in these viral areas. We need to then move beyond that and make sure the patients that fall between the cracks, what can we do to help support those patients, particularly if they start to get into advanced HIV disease? And we've come up with areas of programs that can focus on cryptococcal meningitis, for instance, or visceral leishmaniasis. These patients have unique challenges as it relates to fungal infections. We've actually had the opportunity to develop solutions around that as well. But as I mentioned before, we're pretty much the special forces, and we have the opportunity to come in to countries and build these partnerships that really make a significant impact as we move forward. And so just to be very clear, we're a virology company. We really focus on HIV, hepatitis B, C, and D, and have innovations and solutions for patients to seek care in those areas. And then we're slowly moving into other areas where non-communicable diseases and communicable diseases, we shouldn't separate those two in Africa. I think it's important for us to recognize that they come hand in hand, and we're also moving into the area of oncology. Now, with oncology, it's interesting, people discount oncology as not being something that affects Africa. And I think we need to recognize that it affects Africa, and in some cases disproportionately. In the case of triple negative breast cancer, we see that not only do we need to invest in the patient pathway associated with that, but to create opportunities for patients to get to centralized care facilities so that they can be diagnosed and treated. And there is money available in each one of these countries to try and do that for a significant portion of the population. So it's a balancing act that we do, and as a part of the special forces within Gilead, our GPS group, we have the opportunity to do that, not only in Africa, but in over 100 countries around the world. So I'll leave it there, and we can get into more details a bit later. Thanks a lot.
Thank you so much, Christopher. A lot of things I picked from your speech there. NCDs, and I totally agree with you when you say NCDs should not be separated from non-NCDs on the continent, not at this point at least. Considering the state of our healthcare infrastructure and the need to channel more resources in that direction, it's critical to not begin to lump this into different buckets. Also, just want to say that what you have said also re-emphasizes what my earlier comments and Dr. Anton's initial speech, which is the need for partnerships, the right kind of collaborations to ensure that you have the right kind of results when you come to deploy all of those projects on the continent. I think it's very critical to ensure that you're mapping right. And of course, you then are able to achieve the right kind of results as you progress with the work you do on the continent. So thank you very much, Dr. Christopher. Once again, I will move over to Sally. I'm saving the best for the last, well, semi-last, if you'd like. So Sally, the private sector's role in driving global health transformation was recently highlighted in the announcement of the World Health Organization's recommendation of the world's first malaria vaccine. PATH, one of the health security and Resilience Initiative's members is a leading partner supporting the pilot introduction in Ghana, Kenya, and Malawi, leading to this historic announcement. Now, directly, the demand for the malaria vaccine is likely to outstrip supply. What is the biggest challenge and opportunity moving forward in addressing the demand and supply of the malaria vaccines, wherever it is that you're deploying them?
That's a great question. First, I'd just like to thank Flory and Jeff and the rest of CCA for this opportunity to be part of this panel today, whether you're in a morning, afternoon, or evening. Just a quick note about PATH. I don't know how much CCA membership know in general about PATH, but we are a global health organization. We've been around since 1977. And sometimes I like to say that partnerships are part of our DNA. Even before the term product development partnership or public-private partnership were actually coined, PATH was partnering with the private sector to develop technologies appropriate for use in low resource settings. And we've kept that focus over the course of the last 40 plus years. And we do a lot of multi-sector partnerships, bringing together government partners, private sector partners, big partners, small partners, academics, to actually drive innovation, both in terms of technologies and tools, vaccines and other types of tools, but also in innovative approaches to healthcare delivery. We have about 1,500 staff. We're active in 70 countries, and we focus a lot of our attention in sub-Saharan Africa because of the partners and the needs that we know that we have in that part of the world. And I work in the part of PATH, it's called the Center for Vaccine Innovation and Access, as part of the PATH Malaria Vaccine Initiative. And this is a group of people that really has experience from every stage of development, starting from the preclinical research, kind of novel candidate, early discovery work, and then all the way through introduction, evaluations, and also working on things like immunization system strengthening. And so a lot of different kinds of work. This pilot implementation, this has been an amazing few years to be part of this. I myself have worked with the RTSS vaccine since joining PATH in 2007. So it's been a wonderful year as we've seen the accumulation of data and all of the other kind of positive decisions kind of piling up this year. It's really been quite remarkable. And you are correct. We are operating in what is likely to be a supply-constrained environment. We know that the potential demand for this vaccine could pretty soon outstrip 50 million doses, and a steady state demand has been estimated at somewhere in the 80 million plus doses of vaccine annually. I think what's important to note is that our partner GSK has already committed to providing a certain amount of vaccine even before this demand is really concrete. And for those of you who work in this field, you know that it's one thing to have kind of a projection of what the demand is. It's very different to actually make an investment decision about how you might actually meet that demand before there's even a vaccine tender actually out there. And so I think we're very fortunate they've actually made this commitment and have made that commitment over many years. And of course, they have also provided a commitment to donate up to 10 million doses for use in this very large pilot program, which as of October had reached 830,000 children with, I think it's an estimated 2.3 million doses of vaccine. So we're heading towards 1 million children being reached in this pilot introduction in parts of Ghana, Kenya, and Malawi. There has been some other positive steps, and I just want to note that GSK and PATH and WHO and now a growing group of partners and stakeholders are really committed to addressing this issue of supply constraints. And just want to flag a couple of really positive developments this year. One, of course, was the announcement that we made at the beginning of the year about GSK, PATH, and Bharat Biotech agreeing to product transfer of the vaccine, including manufacture of the RTSS antigen to Bharat Biotech in India. So that is one really important step. Another one was an innovative cost-sharing arrangement agreed by Gavi, GSK, and MedAccess to support continued manufacturing of the RTSS antigen by GSK, even before the WHO recommendation and the Gavi board decision were made. And again, helping share the risk. Of course, now that that Gavi board decision has been made, that happened just last week on December 2nd, to actually finance a malaria vaccine program moving forward. Now this enables Gavi to start the kind of market shaping activities that they are known for. And they will be working with Gavi and other stakeholders, including PATH, to ensure that we do get to a situation where there is adequate supply to meet demand. Additional investments will be needed. I just want to point to the experience with COVID-19. This has really shown the value and impact of risk sharing in manufacture alongside research and development. And COVID-19 vaccines have benefited from some pretty massive upfront investments. We are working in the environment of a malaria vaccine with a vaccine for which there is no lucrative market, no dual market to actually kind of help offset the low income and middle income markets in which this vaccine will be made available, presumably primarily through the private sector and with the support of Gavi. And so one thing is going to be, yes, there will be a need for additional resources to actually scale up capacity to meet potential demand. But there are other ways that we could actually increase the supply as well. And for those working in vaccines, this will be quite familiar to you. We can look at, for example, the use of fractional doses, which would also in effect increase supply. We have done some research on this area, but more will likely be needed. And that is another key thing. And I just would note that with the work that we're doing, we're working with a growing group of partners on this. We welcome more partners to take on this challenge. And I hope that addresses your question. Happy to answer in additional detail, but I'll stop there for now. Thanks.
Thank you very much, Sally. I think that more than anything, we cannot play down the need for partners to continue to fund equitable access to medicines and vaccines on the continent. Partners like, collaborations with partners like Gavi, etc., who traditionally, historically fund such programs. And of course, just to also reemphasize, one point that keeps coming across all of the panelists is the need to forge the right kind of partnerships to ensure that you can deploy your programs on the continent, at the scale you want to. Great example with the donations by GSK of 10 million doses. I mean, that is also as a result of the kind of partnerships that you have in that space. I'll come back to you, but I think that let me just take a question let me just go over to my fourth panelist, Mohammed. Glad to have you here, Dr. Mohammed. It's been very interesting conversations thus far, and both access and quality of healthcare services are critical. We realize that for achieving universal health coverage goals on the continent. We know for a fact that Medland, that you represent, has been on the front line in Zambia specifically, and also you're looking to take healthcare service delivery model to scale in the region. So the question I have for you is, what lessons and opportunities can we draw from your organization on the private sector's role in complementing public health service delivery?
Thank you. And indeed, that's a very interesting session. I think the panelists have shared with us their views, but also very valid points. I do believe that the private sector has an obligation, not only a role to play, but it's more an obligation to come and complement the efforts of the public sector. For one reason, which is the fact that we all know what are the resources in healthcare in the public sector and the large volume of people that they have to serve. And therefore that, for example, may answer a little bit the reasoning behind letting some cancer patients left behind or not having access to new technological treatments or to updated treatment and diagnostic tools. The thing is that we are not here to compete with the public sector. And I think that also for one reason or another, there is an image that the service that is provided in the public sector is of lower quality than the one in the private sector. And that is not true, to be honest. I mean, we at Medland Hospital, yes, we are a private sector, but we do have colleagues coming from the public sector for certain services or certain specialties. And we are seeing excellent results. That is a proof that we have the skills, we have the manpower and the human resources. What we lack are the investments in new technologies, investments in new diagnostic equipment, in investment also in appropriate treatment that the public budget cannot take care of. So if we have a mandate to support the public sector, to support the public institutions, so that we break that image that everyone has in mind that, okay, if you are poor or if you cannot afford, go to the public sector. If you are rich, go to the private sector, you will receive a better treatment. That is not the case. We all are serving to provide a quality care. What we do probably in the private sector is that we have a more structured team. We have a hierarchy that we do respect. We have a transparency that is more applied, not because the public sector does not want to be transparent, but because we do separate departments in terms of procurement, in terms of finance, in terms of administration, etc., which are intricated in the public sector. Now, that is one thing. The second thing is that from COVID-19, we have learned that that relationship between public and private sector is crucial to save lives and to offer everyone the quality care that we aim to. We have seen that in many countries in Africa, the first approach was to ask the private sector to set aside that the public sector will take care of everyone. And that didn't work. So the public sector needed the private sector, but also the private sector needed the public sector in setting up strategies, in putting a vision on how to fight the pandemic. And the visions have been different from one country to another. Same is now happening with the vaccine. We are seeing that the private sector is more and more playing an important role in addressing the vaccination fear, in addressing the vaccination hesitancy, in addressing the anti-vaxxing movement, because we are also on the ground near, we are there, we are next to everyone, we are there to answer their concerns. The other thing is that the private sector with any investment, because it's easy to have an investment, honestly, it's very easy to have a fancy building. That is not the challenge. The challenge is in knowing where to invest and in what field. And to know in what field or what to stress on, for example, we do need the public sector in terms of research, development, statistics, because they have the biggest volume. And that is very important. So for example, for a private investor to come in and invest in a cardiology department or in a cancer department, etc., we rely a lot on the information that is provided by the public sector. They give us a very clear idea and picture of what is happening on the ground in terms of healthcare. I do believe from our experience, Medland Hospital is probably the first private entity to sign an MOU, for example, with the Ministry of Health. How did that benefit everyone? Well, simply because we have seen that now patients have access to services that are not provided in the private sector. Patients were sent abroad to India, to South Africa, and to any other country. And simply by being referred to Medland Hospital, which is an in-country private partner, that will reduce the budget, but also the health budget. But also, on the other hand, that will also empower the local skills, because we have a strong, robust training program that is ongoing, where we have our colleagues from public sector coming in and being trained on the same services that are not probably available. The third thing is that by ensuring that those services are there, we are pushing our partners from procurement related entities to reduce the cost, because this is one of the barriers in Africa. Due to the fact that we don't have a large volume of patients, the supply chain comes out very expensive. So by partnering, by increasing that volume, by mitigating all these risks, I think that it's a win-win relationship between private and public sector. Maybe this will also enhance a better relationship between private players in the future.
Thank you very much, Dr. Mohammed. I see that medical tourism as a whole, the kind of partnership that you envisage in the work that you do would reduce to a large extent the incidence of medical tourism. And of course, it has a ripple effect on ensuring that countries can grow, they'll save much needed FX, foreign exchange, and it has a ripple effect around the economy. So that's great work that you do. That symbiotic relationship that you talk about reflects also the partnership conversation that we've been having across board. Very interesting to see that you always need to work with the private sector. There is no competition between both sectors, and nobody is trying to outdo the other. I mean, that helps you ensure that you deliver the right kind of treatments and programs and projects that you can safely deliver on the continent. Perfect, great example that you have given there, and good work you're doing there. I'll just go around to all of my panelists and throw a couple of questions. I've seen that all of the examples you've given, great work that you're doing in different areas, really speaks to the successes that you have had. I think that the people on this call would also like to hear a bit more about one or two of the challenges that you have had, ensuring that you have the right kind of public-private kind of partnership with government, seeing that you're all private sector, and of course, maybe some suggestions as to how you think that you can resolve or these challenges can be resolved going forward. I mean, this will help people who want to go into the continent also to deploy projects in the healthcare space. So I'll go to Dr. Anton Bizo first to share examples for us.
Yeah, thanks again, and great job to all of our panelists. As far as some of the challenges, and I'll say from the health side that we've seen, and really being part of the public infrastructure within the Democratic Republic of the Congo, and really as a large company, really trying to fight different, like I said, 5 different pandemics or epidemics that are going on within one country. And that's really, for us, is really the availability of the medications, and not just the availability, but more so the affordability of medications. That's something that we have to really deal with. But for us, it really comes down to the leadership within the countries. I see where some countries are doing much better than others, whereas others have not, because of a lack of, I'll just say, true leadership in this particular area. And then also it's just a mistrust of the system sometimes. As I mentioned, we have less than 1% of the population in the Congo that is actually vaccinated. And these are some of the things we have to really think about. How are we going to have access to the medications and the vaccinations? How do we work with the public health systems, and how do we strengthen that? How do we even diagnose or even get the right diagnosis for why people are dying? So I think what we have to do as far as the public and private sector is really, how do we come together? How do we build this? Because the challenges are great. And I think if we begin to focus on really some of the local production of some of the vaccines, and I see where that's taking place as well, that will also help with that coordinated response. Because when we're looking at the ecosystem or the supply chain, sometimes it's easier to have the production right there within countries. So the challenges are great, but I know that together we can overcome them. And so that's just my bit to this question.
Great, thank you very much, Dr. Anton. Christopher, over to you.
Thanks a lot, and thanks for not promoting me to doctor. My mother would love it, but I'm actually not a doctor guy. So yes, listen, I mean, let's just talk about collaboration, because there's a lot of loose ends everybody with a similar focus, but they're all trying to make it happen. Health security needs to be, more than just mechanisms and multilateral, research and development, even more than money. It needs to be collaboration. In our discussions and reflection on the COVID-19, it's become clear that the role of the community healthcare workers and the primary healthcare service cannot be stressed enough. Strengthening primary healthcare service delivery, as mentioned in several, declarations over the past few decades, is really key to success. One of the things we're able to do is to work with partners across a kind of a diverse spectrum of specialty to train and empower female healthcare workers in Africa and also in other geographies. They are the backbone of health delivery, I would like to say, in Africa. In South Africa, we have probably 35 or 40,000 health support community healthcare workers that are there, and supporting them so that, and also that think about, it's not just about going after AIDS or HIV or going after hepatitis or going after diabetes. The community healthcare worker actually carries with them the entire portfolio that they need to do that. So continuing to support and strengthen them is really important. And let me just also say, I saw in the chat, there was a question about some of the other challenges in dealing with the governments. Two things are important. One, I think that we need to make sure that the government understands that we're not just talking a good game, but we can actually deliver what we're talking about. Governments struggle to try and allocate budgets for hopes and dreams. If we can give them hard evidence that we can actually change the natural history of disease in those countries based on experiences we've had in other places, the confidence that they can allocate large amounts of their own hard budget towards these programs, and we can actually deliver those outcomes. And we've had success in Egypt and South Africa and other places where we can demonstrate hardcore evidence that we can actually deliver. And then the final piece would be, and I'll just throw this out there, let's think about impact funding of different projects, impact grants, impact bonds. What if we could, analyze the value of our solutions to the system, show that we can monetize public health care, and people can, let's just be honest, commercially attractive opportunities to invest in public health care. There are many companies out there that have created impact funds, and the highest percentage return I've seen recently is 13%. So all of a sudden, they're actually making money and doing good. What's the opportunity there for us to do that?
Great, thank you, Christopher. I'll move to Sally now.
Yeah, I mean, PATH is in a slightly different situation in that we're a nonprofit organization. And I think that in some ways, this can be a little bit of an advantage when it comes to dealing with government partners. Whether we like it or not, there's always this question of what is the motivation behind a particular entity. Yeah. And I know that sometimes the private sector faces this question, the for-profit sector faces this question in terms of what is the motivation. For PATH, all of our work is supported. We can't do anything without the support of donors. That's how we do our work. And we also have been engaged in some parts of the world literally for decades. We opened an office in Vietnam, for example. I think it was in 1980, one of the first nonprofit organizations to open up in that country. And we've been working in sub-Saharan Africa for decades as well. And so we have built up relationships. We've had the opportunity to build up relationships with governments over many years, because we are also focused on so many different areas of work. We work on maternal and child health. We work in kind of the technology development, but also in HIV, AIDS, and TB, and reproductive health, and just a wide range of issues that mean that we have potentially had the time to establish these kinds of relationships. What's all about, though, is trust. And I think that I want to come back to the work that we've done in partnership with so many people around our TSS, the malaria vaccine, because it has been about building trusted relationships with our private sector partner, with GSK, with the donors that have supported our work, with the other partners, the African research centers that did this, and with the ministries of health. I really want to highlight that this pilot program, for example, it is led by the countries. They are responsible for actually implementing the vaccine. The program overall is coordinated by the World Health Organization. And there are dozens of partners, both globally, but also in the countries concerned, to actually almost comment on one of the questions in the chat. That, you know, this is all about lots and lots of people working together in support of a common set of goals. And that is why the success has been possible. So the other thing I would just note is, you know, it's always about having boots on the ground. You know, if you've got to have people in the countries where the work is being done, and to the degree that the private sector can actually do this, it's really, I think, very important. And also, if it can be done with others, I mean, there's strength in numbers. If we can collaborate in order to have that happen, it is just tremendously powerful. And I'll stop there. I think that's enough for right now, but thanks.
Great. Thank you very much, Sally. Dr. Mohammed?
Well, first I have to commend Sally because she used the magic word, trust. And I think that's the biggest challenge also for any facility. We have to build trust with our patients, with our partners, and that includes the public sector. I just wanted to add that when we say that we have to work with and complement the public sector, we are not only talking about the healthcare sector or the public health institution. We are also talking about the education sector. And I take it in two ways. One, because we have to really empower the local skills. And this will help us in implementing the research studies that were mentioned by my colleague and fellow panelists, etc. But on the other hand, we have to educate people on what is health. Because we are seeing today, for example, we know that compared to last year, we have an increase in diabetes worldwide. We have an increase in comorbidities and non-communicable diseases in Africa. We are a growing population. We used to be a very young one, and now we have a somehow interesting elderly population. We have an increase in cancer diseases. So how do we address that? First, we have to teach people on what is health and why they have to come in for any medical service at an early stage, which means that we have to not only focus on the disease when it happens, on a symptom when it happens, but also we have to encourage people to make use of all the preventive tools that we can offer them. And that only happens in schools, in universities. It doesn't only happen at home. So it is important also to cooperate with the education public sector. We need that partnership. We need the partnership with any education institution, private or public. I keep on repeating that because we, as I said, we can have the best hospital ever. If we don't have the team, it won't work. We can have vaccines. We have them in Africa. Yes, I mean, we do have an unfair distribution of vaccines worldwide, but we do have in some areas vaccines. We don't have the people. And that is because of education. That is because we don't know how to communicate with everyone and every category of people, rich, poor, old, young, healthy, non-healthy, women, men, etc. So it is important also to strengthen that relationship between the education sector and the healthcare sector. And that brings me to also, like, we have to come out of the box and to look at it from different angles. Today, in many countries in Africa, and Zambia is among them, we have green ministries. We have to see how we can work with them. What does this mean? How it can improve the health of the people? How we can reach a healthy community in 10 years or 15 years. And that only happens with those partnerships with the private and with the public sector.
Great, thank you very much, Dr. Mohammed. I still have time for just two minutes for the panelists to take one round of questions before we then go to the questions I see popping up on the chat box. So quickly, I'll just go to Dr. Anton Bizo. I don't know if you've touched on this yet, but how do you think the private sector can position itself better to address the demand for various capabilities on the continent? So we see that there's a huge gap in terms of capabilities on the continent. How do you think we can position ourselves better as the private sector through partnerships with governments and local stakeholders?
Yeah, I think all the panelists really addressed that somewhat, but I would like to talk about what Dr. Sahili also said. The education system is one of those areas that I think we have to really begin to look at. Just recently, when we were over in the Congo, we began to work with an orphanage. Orphanage has about 300 students that come there every day, 60 stay overnight, but we have to start early. If we're involved, like we're involved with maternal child health, from 0 to 5 years old, we have to really start early. And what opportunities can we do through corporate social responsibility in working with some of the local organizations in starting early to put that in their minds? And then also, do we work with, let's say we're in a situation now, do we work with all 300 students, or do we pull out a subset of, let's say, the older kids and begin to get them involved with healthcare, or just from the standpoint of a policy, and so that they can be the change agents? And so I believe that if we are companies that are there doing some great work, we need to start early, because that's the kind of partnership we need to do to develop. Because in the end of the day, we know that we have major challenges on the continent, but it's just like every other continent and countries all across the world. And I think if we begin to show them that they can do the things themselves, and we get those larger partners to help, that we can produce locally, we can communicate, market our products locally. We can also deal with some of the challenges that we're facing with the supply chain. But again, we're dealing with a supply chain, a supply constrained environment, not just there on the continent, but also everywhere. How can we really begin to address some of these things? And I think through our partnerships, making sure we have that right data, making sure that it's informed by research, and that we're coming up with those solutions that are really going to be major game changers.
Great. Perfect summation. Christopher, what are the highlights and opportunities can we draw from your work?
Well, highlight-wise, one of the things that we were able to do quite early is to align with the needs, wants, and desires of specific countries, and make sure that we're the ones that need to be flexible to make sure that we can accommodate where the gaps are. And I think that, going in with an approach that I have, one size fits all approach really doesn't help. It drives me absolutely crazy, because I would love to copy and paste and just say, hey, it worked here to work with you. But we go in, the first thing we do is listen. The first thing we try and understand is the patient's pathway. How do we actually get the patient from A to Z? And sometimes it's similar, but in a lot of ways it's different. And I've learned to be very patient and focus. And, for instance, in the mother-child transmission programs, we have a very specific idea what that looks like. But when we get on the ground and we talk to the people, we understand that it's slightly different. We need to make some changes and modifications to our approach, and we're happy to do that. The last thing I'll say is an internal need, because I think most of the time when we're dealing with low middle income countries, most pharmaceutical companies will prioritize the world in different ways. We need to make sure that our pharmaceutical leadership recognizes and appreciates the importance of being aligned in areas that may not be as commercially active as other parts of the world. And that sounds a little bit controversial, but I think we need to appreciate the fact that, as we look at ESG and the new environment of how companies are being assessed, what we do for societies, what we do in terms of equity of care, what we do in terms of access to our medications truly matters. And I'm happy to say that in the case of Gilead, we can point to the 17 million people that we've touched with our medications. Not nearly enough. And so we'll continue to try and drive that. But I think it's important to look at it from that approach. And the world is becoming a smaller place. We're recognizing that a lot of the solutions are coming from the ground up as opposed to wherever down. And COVID has taught us that. And so I think it's important for us to recognize that.
Great. Thank you, Christopher. One last question for Sally as well. The World Health Organization's announcement references that the malaria vaccine will be accessible to only malaria endemic regions. Can you shed more light on what this means?
Sure. I think it's important to note that the RTS malaria vaccine was really developed with the idea that those most affected by malaria are young children under the age of 5, and most notably in sub-Saharan Africa. The second most vulnerable population, as people may know, are pregnant women. But this vaccine is really targeting young children. When you think about having a vaccine that might be suitable for travelers or for the military, typically those vaccines need to be pretty high efficacy, very high efficacy. They have to be very, very effective. In the case of malaria, we have good prophylactic kinds of drugs, preventive drugs that can be taken by people who are going into the region for a limited amount of time. The malaria vaccine is not what you would call a highly effective vaccine. It probably, in the phase 3 trials, it was shown to reduce the number of clinical malaria episodes by about 40%, severe malaria disease by about 30%. And the evidence that we've gathered during the course of the 2 years of this pilot implementation show that, you know, at least we're seeing a 30% reduction in severe malaria hospitalization. But this, you have to keep in mind, could actually be an understatement of the impact just because of the complexities of how it's being delivered. But the WHO recommendation, just to give the specific language, because I think it helps actually people to understand, WHO is recommending that the vaccine be used for prevention of P. falciparum malaria in children living in regions with moderate to high transmission, i.e. parasite transmission, as defined by WHO. And so this means that it's designed for children from the age of about 5 or 6 months, living in areas with some kind of parasite prevalence that is above a certain level. This is mostly the case in sub-Saharan Africa, large regions of sub-Saharan Africa, but not everywhere. But it might also, for example, include Papua New Guinea. And then the other thing, of course, is that it is for P. falciparum malaria, which is the deadliest of the malaria parasites to humans, rather than, for example, P. vivax, which is common in much of Latin America and also in parts of Asia. So we know that the vaccine, it's provided in a schedule of 4 doses in children from 5 months of age. And there is also the option for its use in settings of highly seasonal malaria, where there has been a really exciting phase 3 study that's been done recently that showed that combining seasonal malaria chemoprevention, SMC, with RTSS resulted in massive increase in terms of these 2 interventions working together. Sorry for the noise there for a second. But anyway, I think that probably gets at the answer to the question. But we're very excited to have a vaccine that could actually help reduce the burden of malaria disease and death in the most vulnerable population, and that is young children, especially in sub-Saharan Africa. Thank you.
Thank you. Thank you for that answer, Sally. One last question for Dr. Mohammed. The kind of relationship that you have working with the private sector or private health institutions in Zambia, it's quite a unique one. Do you see yourselves being able to scale up that relationship to other countries, or scale up that proof of concept, as it were, to other countries? It would be interesting to see that, or it would be important to see situations where private medical institutions like yours and public sectors work in such a symbiotic manner to achieve results that you achieve. Do you see you doing that in other countries as well?
I think we are already doing that. First, because Medland Hospital is receiving patients from neighboring countries, and today we are in talks with our neighboring countries to see how we can offer those services in countries. For example, let's say Malawi or Botswana, or etc. So that's one. The second thing is that what we are doing. I don't know if some of the people today attending, they are aware, but Medland Hospital has launched the Q Medland program, which is centered around mobile units that can provide services in times of crisis, and that has been already of an interest for other countries across the continent, and soon the project will be launched outside Zambia as well. I believe that any creative, innovative idea that will work on, again, empowering local skills, on empowering local manufacturing of, for example, the mobile unit, etc., it is of interest. Healthcare is an interesting sector, a very challenging one. I think also the approach that we have taken in Medland Hospital, I've said this yesterday and announced that a week ago, we don't want anymore to provide what we thought was healthcare. We do believe that today what we have done for the past few years is sick care. So we were just taking care of a symptom or a disease. Today, Medland Hospital wants to do healthcare. And when we say that we want to do healthcare, it means that we want to join the people that are on this panel, the people who are outside in the healthcare field, and to address the fears, the concerns. Why do people, for example, accept a malaria vaccine and are eager to take it, and they do not accept the COVID-19 vaccine? There are concerns. Why does a woman come late for a breast cancer diagnosis, while if she sees any simple symptom on her child or on her husband, she brings them both to the clinic? So also that means that we have to empower women. The fact that we are much focused on water management and waste management is also a proof that we want a healthy community. So all these, I'm giving examples that are attractive to many African countries, and that is the main reason why we are already in talks with those countries, and in some cases we are in an advanced stage. I'm not saying that we are not in healthcare business, we are, but the fact that we can take this to another level, the fact that we can work with different players, I think it is the beauty behind healthcare in Africa.
Thank you so much for that response, Dr. Mohammed. Now we have just about 7 minutes to go into Q&As from the audience, and then we'll wrap this up. So I'll just, as much as possible, brief answers to my panelists, if you can. This is to Sally Ethelson. Are there plans to help build regional health resilience in Africa by identifying collaborative hubs? For instance, in South Central Africa, which can be technically capacitated through multi-sectoral partnerships to accelerate regional vaccine access through medical upskilling and resource sharing. Is that clear?
I can try to answer that question. I put something actually into the chat, and I would just note that first of all, of course, one of the things I would just remind as a nonprofit organization, we unfortunately don't have resources to go out and do everything that we might like to do. We are reliant upon the support of partners and donors in terms of doing our work. I would point to some of the work that I know that we're doing around COVID-19 vaccines, which is around really providing technical assistance to vaccine manufacturers in Brazil, China, Thailand, and Vietnam. We've done a lot of work in the past providing technical support for improving manufacturing systems, quality management, and other aspects of vaccine manufacturing in China and India and other places. So I would say that in principle, we stand ready to provide assistance where we're able to, including in sub-Saharan Africa. I know that at one point we were actually supporting the establishment of a kind of a technology hub in South Africa. I'm not sure of the status of that work at the moment, I'll be honest. I'd be happy to get back to the group with a more in-depth question on this. But I think the key thing is we all recognize that when it comes to vaccines in particular, we've learned from the COVID-19 experience about the importance of actually having manufacturing in the places where the vaccines are needed. That is, I think, just a core principle that we have to recognize moving forward. Of course, this is going to take time. And we hope that we would be able to do work in this area. When it comes to the RTSS vaccine, I would just note that in selecting Barrett Biotech as the partner for product transfer and to manufacture the antigen, there's a pretty comprehensive process that was undertaken. And because we want to make sure that this vaccine can indeed be made available as rapidly as possible where it's needed, we looked for a partner that had a pretty strong track record, including WHO pre-qualified vaccines, and Barrett Biotech has a number of those. It also has a total of 17 licensed vaccines. But we are very aware that there is a need to do more in terms of bringing vaccine manufacturing to sub-Saharan Africa. And at PATH, I can say that we're happy to help where we can. Thank you.
Thank you, Sally. There's a second leg to this question, please.
Sure.
To what extent is there interest or ability to partner with nonprofits providing frontline healthcare services in the region? Is there an interest?
Well, what I would note is that the work that we do involves partnerships with everybody. We partner with a wide range of nonprofit organizations, both at global level and also at local level. So again, if we look at what's happening with the pilot program, it involves partners in all of these countries. And so it's really how we do our work. If we're going to go out and do research, for example, on community perceptions of malaria and vaccines, which is something that we did in the run-up to this introduction, we partnered with local organizations like AMREF in Kenya and other organizations in Burkina Faso and Mozambique. We do that work in partnership with others. So for us, that is kind of the way that we do our work. So we're always open to more collaborations and more partners. I mean, it's just, this is how we do our work. PATH we don't do things by ourselves. Like they say, if you want to go fast, go alone. But if you want to go far, you go together with others. Thanks.
Awesome. Thank you so much, Sally. I'm afraid we have only time for only one more question. And any of the panelists can respond to this. Is there any plan for any of your different companies to expand into West Africa and would like to partner in any of these two areas?
Well, I'll be very brief. Yes is the answer. We've segmented Africa into 3 regions because of the logistical challenges and have identified specific leadership for each one of those regions. So West Africa is, West could be French speaking as well as Anglophone. So yes, we have activities and operations that reach into West Africa. We have probably about 10 programs that we're currently running in West Africa. So whoever asked the question, please reach out to me either on LinkedIn or just using CC as a connect, and I'm happy to engage you.
Yeah, and I'll say the same as well. We have established an operation in Nigeria. And so as far as West Africa, we're looking at it from the Brazil group as far as hubs as well. And so that's why we're stationed in the Congo, as well as in Kenya, as well as in Nigeria. So if there's anyone out there that's willing to definitely work with us, we're excited about it because like we said, if we want to go far, we go together.
Great. So thank you so much for all of those responses. For all the other questions, we would take a note of them and perhaps send you, since all of the names are there, we'll reach out to you with the responses. And I just wanted to say that thank you so much to all of the panelists. The conversations have been quite insightful. And I think that very, very mind-boggling, some of the issues you have raised and some of the solutions you have proffered. And I also want to thank CCA for providing this platform for all of us to air those opinions. And I want to say thank you to the audience for joining. And it's been great facilitating this session. Thank you. I'll hand over to Flory to take charge.
Wonderful. What a great discussion. I tell you, I always learn so much in these. And excellent job of moderating our distinguished panelist. Before I turn it over, though, to Dr. Jeff Sturcio to provide some closing remarks, I really have to say thank you to the team at CCA. We're very small. You know, I always tell them that we punch above our weight. And so I just want to say that, you know, managing the health security and resilience initiative, which we're so proud of and look forward to going into the second year, really could not happen without some people. So I just have to say my thank yous now. So Mariah Essier, who has been managing the program since the very beginning, Joseph Wanyoki and Njoroge, who we brought on board and has been, you know, such a valuable asset to us, Laird Trieber, who's been writing really excellent editorials and helping us in so many ways. I hope you'll go on our new website for HSRI and see some of what we've got there, including those editorials. I also want to thank Carla Battle, who is our director of events. None of the HSRI events that we have done over the course of the last year could happen without her input. Stacy Pompey, who markets it, all those lovely notices that everyone gets, you know, that's her work. And Akego Okoye, who is our director of member relations and makes sure to stay connected to all of the health sector members of CCA who are a part of this task force. I just want to thank all of you and the rest of the CCA team. Not a whole lot of others that are part of the team, but I just want to thank all of them. So with that, let me turn it over to Jeff. Jeff, please. Jeff, we can't hear you. Jeff, if you could unmute.
Of course, I would be on mute after all that. Let me start again. I just wanted to thank all the panelists for a really lively and wide-ranging discussion. I think the theme for the morning session is, if you want to go far, go together. And I want to just make 4 points about what we've heard and how this relates to the work that CCA is doing under the Health Security and Resilience Initiative. You know, one of the pillars of the initiative is to look at universal health coverage. You know, that is the movement to ensure that all people get all the services they require from a health system when and where they need them without financial hardship. And that's what all countries are committed to do by 2030. We've heard a lot of examples of how the organizations represented today are working to do that. And to ensure that countries get to universal health coverage. At the same time, we've heard from some of the presentations about how COVID-19 and the pandemic response has sort of put a stick in the spokes of the wheel of providing universal health coverage. But the first point I want to make is that building resilient health systems in Africa, which is what we all hope to do, is something in which the COVID-19 response can be seen as a forcing mechanism to think about the changes that need to be made to provide better healthcare for everyone. You know, there's a tendency in some of the discussions where we're thinking about healthcare in Africa. We think about money on the one hand, because it always seems to be in short supply. And we think about essential medicines and technologies. And, you know, Sally talking about the RTSS vaccine, you know, Chris and the work that Gilead is doing, getting their medicines for HIV and HCV to many people. Of course, Ike's company is doing that work, and we heard from Pfizer before with vaccines and medicines of various kinds. But let's not forget that resilient health systems also require the capability building for the healthcare workforce that Anton was talking about. They require information systems, leadership and management. They require service delivery and supply. And Mo, you know, talking about Medland's experience reminds us of that as well. So the second point that I wanted to make relating to how we're going to come up with more resilient solutions for public health systems in Africa is that we need to take a holistic view of the healthcare system. And this is an area where, if you just stop and think about it for a minute, much of the discussion in global health about system strengthening posits or has almost an implicit notion that health systems are public sector enterprises, And the private sector has to sort of help to integrate with a public sector health system, although they're not really seen as part of it. But the reality is, and this comes out of all of the conversation we've had this morning, is that the private sector is very much a part of a country's health system, just as the public sector institutions are. And if you don't take into account the fact that you have to find ways to collaborate across the boundaries, and if you don't understand the interdependence of both public and private resources in a given health system, you're not going to be able to find the common ground that will lead to new solutions, and you won't be able to align and adapt those solutions in ways that are really going to be optimally effective for the population in question. So that's, you heard different examples of this from each of the speakers about, Mo in particular and Sally talking about interdependence. Sally raised the question of trust, which is so important when you start to create partnerships to work together across the public-private divide. But I think that point about finding common ground and working together, it's easy to say and it seems simple, but it's incredibly profound, because that's where new solutions are going to come from. The third and fourth points I wanted to make are not quite as profound. But by the way, before I go there, the other element of partnerships and finding common ground is that these solutions have to be multi-sectoral, because health systems reflect the kind of interdependence in society. It's not just health businesses or health NGOs and other health institutions, but where people live, learn, work, and play is actually a more important determinant of what kind of health outcomes they're going to have. And so we need to take those circumstances into account, and think about social determinants of health, as well as what happens in the clinic and through the interactions of health-related organizations. The last 2 points are just, I wanted to make sure that I highlighted what Anton talked about with respect to the way in which the US government and the African Union are really important mediating institutions for helping the private sector to find ways to establish that common ground with partners in different health systems. And he talked about the Small Business Administration, the Department of Commerce. We have examples of USAID and CDC. And we all have been, through the COVID pandemic, we know how the African CDC has played such an important role in bringing all these partners together throughout the African Union. So I think that's another important element of this collaboration and interdependence. And finally, I just wanted to highlight, as several of you mentioned, that there has been a tendency to think that Africa's health problems are largely due to infectious disease. The big three, AIDS, TB, and malaria, and now COVID-19. But let's not forget that non-communicable diseases, and Chris talked about cancer, for instance, non-communicable diseases kill many more people in Africa than some of the infectious diseases. And so health systems have this dual burden of dealing with both infectious or communicable and non-communicable diseases. And to come back to where I started, and just to end, if we are going to get to universal health coverage across the African continent, so that all people have access to all of the services they need when and where they need them, we're going to need to see much more partnership, much more collaboration, many more solutions that take into account the interdependence of healthcare and the multi-sectoral nature of healthcare. But I think that if people work together with the kind of spirit that our speakers today have shown us, and we work in good faith to find that common ground, we can see a bright future for resilient healthcare systems in Africa. So with that, I just wanted to thank the CCA team. I wanted to thank Patrick van der Loo and Ike for his moderation, and also our speakers, Anton, Chris, Sally, and Mo, for making this such an interesting session. So thank you so much, everyone, and we'll look forward to seeing you at our next Health Security and Resilience Initiative event. So take care and have a good day or evening.
Thanks, Jeff.
Thanks so much.
you.